This is Chow, and hopefully this video will give you a basic overview of eye anatomy. This video is geared towards people that will be in the emergency room or in primary care settings. If you're interested in ophthalmology, this is going to be very, very basic. It's not going to go over any of the more detailed stuff that you would need to know. All right, so let's get going. All right, so this is a right eye. We're going to go over just the external anatomy first. So, of course, this is the eyelid. And this margin right here, right between where the, it folds into the eye and where the eyelashes are, is referred to as the lid margin. So sometimes if you have any lacerations, you might say that there's a laceration that violates the lid margin. You have the same margin on the upper lid as well. These two corners of the eye are called the medial and lateral canthi, or canthus for singular. So you can also use these terms to sort of describe any kind of pathology or abnormalities when you're looking at an eye. The punctum is right here. You can't actually see it in this picture, unfortunately, but it's basically where the tear duct begins. So there's going to be a punctum right here on the lower lid on the medial side, and there's also going to be another punctum up here in the upper lid, and that's where your tear ducts are and the entrance to the drainage system is going to be. The white part of your eye is called the sclera. There's actually a membranous portion that overlies the sclera that's called the conjunctiva, and the conjunctiva is what gets all red when somebody has conjunctivitis or pink eye. This right here, this border between where the white and the colored part are, is called the limbus. You might be able to describe, a subconjunctival hemorrhage that reaches all the way to the limbal edge, and so that's what you would be talking about, is the limbus. The colored part of the eye is called the iris, and then of course this space through which light passes is called the pupil. All right, so this is a cross-section of an eye. You can see up here is an extraocular muscle as well as one right down here. The clear portion of the eye in the front is called the cornea, which is actually continuous with the white part of the eye, which is called the sclera. You see it goes all the way around the back of the eye. Here's the clear part of the cornea, and here's the sclera. This part right in here is called the anterior chamber. The anterior chamber is full of what we call aqueous humor, which is clear fluid that the eye produces that helps nourish the cornea. This right here is the iris, which again is the colored part of the eye. And this right here is called the ciliary body. It's what actually produces the aqueous humor, which is produced here. It flows out through here and then circulates around the anterior chamber, giving nutrients and oxygen to the cornea, and then drains out of the trabecular meshwork, which is right over here. Glaucoma is actually a condition where either too much aqueous is produced or the aqueous doesn't drain properly, and it increases the pressure in the eye, which can lead to eventual blindness. These little stringy things right here are called the zonules. They reach from the ciliary body and the muscles of the ciliary process and attach to the lens, which is this right here. This is what helps focus the light and helps you read things up close. So when light comes in through here, the zonules, the muscles, can either relax or tighten, which changes the shape of the lens, which then changes the focusing distance onto your retina back here. This whole portion of the eye right here is the vitreous body, or sometimes called the vitreous jelly, filled with, you can call it vitreous humor, and it's basically gives support and shape to the eye. And right back here is the retina, which is the nerve fiber layer of the eye. So the retina reaches all the way along the back side of the eye. And this little pit right here that you can see is called the fovea, which is the area of the most sharp central vision in the back of the eye. And then here we have the optic nerve right here, which basically is all of the axons of all of the nerve fibers in the retina that travel back to your brain. And then the optic disc is what you would call the blind spot in your eye. Alright, so here's a color photograph of the fundus of a right eye. So right here, you're going to see the optic nerve. So when you have increased intracranial pressure, what you'll see is a blurring of this disc margin, this nerve head margin right here. It'll kind of look not as sharp and clean and nice and round. Here you see all of these vessels coming out from the optic nerve and traveling along the back of the eye. And right here you can kind of see this little area right here where it's a little bit darker. This is called the macula, which is again in the area of central vision, and in the middle you can't really see it very well in this photo, but that little pit where there's the central sharpest vision, the fovea, is right in the middle of the macula here. Hopefully this is the end of the basic eye anatomy tutorial. Hopefully that gives you a basic idea of the anatomy as well as what some things are called, so that you can more easily describe any sort of findings or pathology that you have.